Hello everyone. Happy afternoon everyone. A happy Sunday afternoon. Am I audible and visible everyone? Okay. All right. So happy afternoon everyone. I hope and I believe all of you are doing well. All right. And so here we are in the next Fast 5 quiz. We had the first one on 7th and this is the second one. So I hope all of you have completed attempting the quiz. Please let me know how did you fare in the quiz. So we had the 5 questions. So in the today's quiz, I've tried to integrate it with the first aid USMLE step 1 book as well. So I've got snippets from it to integrate that. Okay. So let's start with that. You can keep revisiting these quizzes are free on Medsynapse app. You can keep revisiting them, revising them, and you will get the PDFs. Both the blank and the annotated PDF basically is available in the Medsynapse app itself. So where will you find the PDF is on the Medsynapse app for all these quizzes. Like if you are watching later on as well and you want the PDF, so you will have all the PDFs at one place on the Medsynapse app by Dr. Nikita. And once you go into the tile of that featured classes, okay, be it on Android or iOS, you would see the quiz solutions wala tab there. And in the quiz solutions, in the Fast 5 mixed bag, you will see the PDF. Okay, right? ऐसे कैसे गलत हो गया? Liquid hernia वाला question गलत नहीं होना चाहिए था, right? The questions were, I think, easier. They were not very difficult. So you should have targeted for 5495, but never mind. It's just a learning lesson. So we are going to learn and quickly make the notes of the past 5 questions. Okay. For all the students who are new here and who are not aware of the Medsynapse app, so we have the sure shot classes on the Medsynapse app along with a lot of KBMDs. That is for the MCQ solving skills. And we have the fast sessions as well. That is first aid USMLE step 1 book sessions as well. And you have the various subscriptions available at very, very affordable price for the Medsynapse app. So if you are facing stagnant GT scores, if you're not able to remember what you are learning, Medsynapse app is the solution for you. Okay. So let's go on discussing our question. The first one here. See, always remember this, that when there are lengthy questions, it is the last 2 lines which are the first to be read in your questions. Okay, that saves a lot of time. So I'll start with the last line, the last second line. This drug most likely will inhibit which of the following processes, therefore decreasing the duration of the patient's symptoms. The second last line, I see that it's a treatment with a neuraminidase inhibitor is begin. So neuraminidase inhibitor drugs basically will act by inhibiting the release. Okay, they inhibit the release of virus from the infected epithelial cells. Is this clear? Right. So let us quickly have, like I said, I'm integrating it with first aid and DKH, I would try to do that, though I am not promising that because of course we don't know some technical errors here and there. So I'm not committing on that, but definitely I would try to do that. Okay. So this is your snippet from the first aid, the antiviral drugs on the Medsynapse app. In the fast sessions, you have the antiviral drugs also available. Okay, so do watch that if you want to learn the antiviral drugs in detail. Focusing here, look at these neuraminidase inhibitors. Basically, they are acting on the release. Okay, the neuraminidase, if you inhibit the neuraminidase, it is inhibiting the release of the progeny. What are the examples of the neuraminidase inhibitor is MIMI. Remember oseltamivir, zanamivir. The vir tells you that this is a viral drug, antiviral drug. The MI tells you that this is neuraminidase inhibitor. It is neuraminidase inhibitor. Okay. And another like a very, very potential question for your upcoming exam, be it AIIMS or NEET PG. Remember this, baloxavir is an anti-influenza drug which acts by inhibiting the endonuclease inhibitor, and that is how it's inhibiting the replication. Let us quickly read about baloxavir. So remember that baloxavir is an influenza drug. It inhibits the cap snatching. What is the cap snatching? So basically the mRNA, we know that it wants a cap. The viral mRNA tries to snatch that cap from the human mRNA. So what is baloxavir doing? It is inhibiting this cap snatching endonuclease activity of the influenza virus RNA polymerase, and that is how it is decreasing the viral replication. Okay, so it shortens the duration of illness. Look at oseltamivir, zanamivir, they inhibit neuraminidase, so they inhibit the release. They are used in the treatment and prevention of influenza A and B. Okay, so how you can remember baloxavir? Remember जो बाल होते हैं, the hair के ऊपर there is a cap. So basically its action is on the cap snatching inhibiting activity, that is endonuclease, so it inhibits replication. So the point that I want you to remember कि एक जो replication वाला drug है वो है baloxavir. It inhibits the cap snatching activity of the viral mRNA, that's basically endonuclease activity. Okay, it is endonuclease activity. Similarly, what do you have about the, what do you have regarding this remdesivir? Right, remdesivir, the drug which was very famous during the COVID time. It is an adenosine analog. Remember, remdesivir is adenosine analog. Okay, DEDE, it is adenosine analog. So basically R for R, it is RNA polymerase inhibitor of the virus. It inhibits the RNA polymerase. Okay, so that is remdesivir is adenosine analog. Okay, it is adenosine analog. The rest of the antivirals, like for the herpes and HIV drugs, we have discussed in our Medsynapse app. Right, so do watch that. So remember, neuraminidase is oseltamivir. What are the drugs which are neuraminidase inhibitors? Oseltamivir and zanamivir. Okay, oseltamivir and zanamivir, neuraminidase inhibitor. Out of this, which can be given nasal? Which can be given nasal? Remember, Zana can be given as nasal as well. Zanamivir can be given as a nasal drug as well. Okay? Clear with everyone? So that was the first question and integrating with the first aid snippet here. Going on to the next question. Right? What is the answer to this one? What do you think is the answer to this one? Yes. So, this is the question which is telling you that abdominal examination shows tenderness of the right upper quadrant. जब भी right upper quadrant देते हैं, the first thing that comes to our mind is cholecystitis. But can someone tell me what is the other important clue that is telling me that there is cholecystitis? What is the other thing which is telling us that there is cholecystitis? So there is abdominal and interscapular pain, there is nausea, vomiting, and the history of 18 kg weight loss during the past 6 months. Okay, so remember that basically significant or a history of rapid weight loss. It is one of the important history which is predisposing to the development of cholecystitis. Rapid weight loss is one of the conditions predisposing to cholecystitis. Apart from that, we know that it's a fat, fertile, female of 40, right? That's generally the history that is given there. So cholecystitis, gallstones, okay, gallstones leading to inflammation, calculus cholecystitis, acalculous cholecystitis is all what we have. Okay. So remember, this is important here that cholecystitis, the right upper quadrant pain along with rapid weight loss is important risk factor for cholecystitis. Okay. What sign do we get positive here? Remember, it is Murphy sign positive, asked very, very frequently in the FMGE exam. Murphy sign positive, a catch in the breath when there is deep breathing, that is Murphy sinus positive. What is the investigation of choice for cholecystitis, guys? What is the investigation of choice for cholecystitis? Acute cholecystitis, chronic cholecystitis. I want you to understand this concept. Right, the investigation of choice for gallbladder is ultrasound. But ultrasound wise, how do I know whether this is acute cholecystitis or this is chronic cholecystitis? Remember that any organ which is acutely inflamed, there is vasodilatation, there is edema. So remember the edema, this will be edematous gallbladder, an over distended gallbladder, right? Chronic inflammation, there is fibrosis, and that is why the organ gets contracted. So you would see a gallbladder which is contracted gallbladder will wall thickening. That's the difference in between the two. Logically thinking, where would you see pericholecystic fluid? Fluid is surrounding the gallbladder. In acute inflammation, there is fluid which comes in. So the question will tell you there is pericholecystic fluid which is present. Okay, surrounding the gallbladder, there would be fluid. Okay, is this clear with everyone? In chronic cholecystitis, we get a sign which is called as West sign, wall echo shadow sign. So basically, because the gallbladder is contracted, there is a stone within the contracted gallbladder. Okay, so what do you see is you will have the wall of the gallbladder, the echo of the stone, and behind that the shadow of the stone. So that is wall echo shadow sign. That is the West sign which is seen. Okay, that is the West sign which is seen. Okay, so remember, this is about cholecystitis. If the question is what is the gold standard for acute cholecystitis, it is HIDA scan. Why HIDA scan is gold standard? Because it can diagnose acalculous cholecystitis as well. Okay, it can diagnose acalculous cholecystitis as well. Ultrasound depends on identifying the gallstone and then the cholecystitis. But HIDA scan, even if it is acalculous, it will show that. Okay, right. So basically, the answer here is cholecystitis. Okay, this is cholecystitis. Going to the next question, question number 3. What do you think is the answer to this one? Excuse me. What is the major clue here? Which of the following sets of laboratory findings will you see in this patient? So you are given calcium, phosphate and parathyroid, and you are given that this is a patient of chronic renal failure. So chronic renal failure, and what happens in chronic renal failure basically? What kind of hyperparathyroidism do we get in chronic renal failure? Yes? What kind of hyperparathyroidism do we get there? Very good. So that is secondary hyperparathyroidism that we see in CKD. Why secondary? So the problem is when there is chronic renal failure, what happens to vitamin D levels? The vitamin D levels are decreased. Why? Because the final step of activation of vitamin D, that is 1-hydroxylase, is not functioning because the kidney is not functioning. So 1-hydroxylation is not happening. So the vitamin D is not functioning. So if the vitamin D is less, the calcium is going to be less. So in CKD, the calcium levels are less. If the calcium is less, so it goes and tries to stimulate the parathyroid hormone. This is secondary hyperparathyroid because parathyroid increases calcium and decreases phosphate. Right. Now, since there is CKD, what happens to the phosphorus excretion is decreased, and therefore the phosphate levels increase because in CKD, the phosphate we are not able to excrete out. So let's have, what will you see in a patient of CKD? First of all, the calcium is going to be less. So either it is your option C, option D, or option F. It's not going to be increased. So rest of the options are ruled out. This is how you solve the questions. You rule out the options based on one thing. Calcium कम है, so I rule out the other options. Phosphate increased है, तो ये वाला option भी out हो गया, ये वाला option भी out हो गया. So now you see that I'm left only with one option, that is option C, even without looking at the parathyroid hormone. We know that parathyroid hormone increases since there is secondary hyperparathyroidism. This is how you approach the questions. You start ruling out the options. Ruling out the options is a very important game changer skill that helps you increase your scores, right? So remember, the answer here will be C. Okay, the answer will be C. Is this clear with everyone? Right? So that was the third question. Again, integrating from your first aid, that is diagnosing parathyroid diseases. So look at the relation of parathyroid and calcium. Okay, look at the relation of parathyroid and calcium. Normal calcium is between like 9 to 11, which is normal. In primary hyperparathyroid, what do you mean by primary hyperparathyroidism? That means it is parathyroid gland problem itself, like hyperplasia, adenoma, carcinoma. So in that case, the parathyroid hormone levels itself will be high and the calcium levels also will be high. Okay, so there will be increased calcium, increased parathyroid. Secondary hyperparathyroid is basically because of the calcium which is less. So vitamin D deficiency, decreased calcium intake, CKD, there is decreased calcium, there is increased PTH. Tertiary hyperparathyroid, which is basically like autonomous condition, everything is high. Increased calcium, increased parathyroid, increased phosphate, everything is high. Okay. PTH independent hypercalcemia, where the PTH is low but the calcium is high. That is like in vitamin D, excess of vitamin D, excess calcium intake. Okay. And in hypoparathyroid, which you see like post thyroid surgery, agar thyroid ke sath parathyroid bhi nikal gaya, so surgical resection, there is decreased parathyroid, there is decreased calcium. Both of that is decreased. Is this clear with everyone? Yeah, so that is your primary hyperparathyroid, secondary hyperparathyroid. You should absolutely remember this. It is very, very important. Okay, it is very, very important. Okay, so this is about your third question. Let's go on to the next snippet from the first aid. That is secondary hyperparathyroid जो हम बात कर रहे थे. The calcium is less, the phosphate is high, the parathyroid is high. Remember, ALP is high and the vitamin D levels are low. Okay, the vitamin D levels are low. How do you differentiate it from vitamin D deficiency? Remember, in vitamin D deficiency, the phosphorus is also less. Right? This is very, very important to understand. Parathyroid problems versus vitamin D problems. That is vitamin D deficiency, vitamin D excess. Remember, parathyroid PT has OPT, that is opposite effects on calcium and phosphorus. One increases, the other decreases. Vitamin D, D for dono go in the same direction. If vitamin D is less, calcium phosphorus is also less. If vitamin D is high, calcium phosphorus is also high. That's what you basically see with vitamin D wala. So vitamin D कम है, calcium भी कम है, phosphorus भी कम है, everything is in the same. So this is a problem of vitamin D. Calcium कम है लेकिन phosphorus high है. These are in the opposite directions and that is why this is a problem of parathyroid. This is not a problem of vitamin D. Is this clear with everyone? Got the concept here? Absolutely. So remember that vitamin D wale problem mein calcium phosphorus go together with vitamin D. Parathyroid wale mein calcium and phosphorus, they themselves go opposite. Okay? That is how you differentiate whether it is parathyroid problem or whether it is vitamin D problem. Right? Going on to the next question. This is your question number 4. Tell me, what do you think is the answer to this one now? Very good. So you must have seen already in the app, if you have solved the quiz, the correct answer is A. Tell me, what organism are we talking about here? Miracles in primary hyperparathyroid, the phosphate is less. Parathyroid increases phosphate excretion, so the phosphate becomes less. What organism are we talking about here? So the question is, this infection could have been prevented by avoiding which of the following? The question is, you can see that there is tumbling motility. Okay, there is tumbling motility. What has tumbling motility is? Listeria. Right? It is listeria. So blood cultures it is showing it is gram positive rod, it is beta hemolytic, it is catalase positive, and it exhibits tumbling motility. So remember listeria list wala. When should you make a to-do list? That is what the mnemonic we have learned. You make a to-do list when you have pulcum, right? Time come hai jab pulcum medium, and you make a list when everything seems to be tumbling down, right? So remember, it is tumbling motility. So remember that pulcum medium tumbling motility is listeria. We saw this in the last fast 5 also when we were reading about neonatal meningitis. Listeria is an important cause of neonatal meningitis, especially when there is premature rupture of the membranes. Okay? Yeah. So, बस वो ऐसे ही distractor है, ठीक है? It's just a distractor which is given there. Right. So, now going to the, so remember that listeria can be avoided by consumption of this delicatessen meats or the unpasteurized dairy products. So, this is again integrating with your FAST, the first aid USMLE book. So, listeria is gram positive, facultative intracellular rod acquired by ingestion of unpasteurized dairy products and the cold daily meats. Okay. So, it is already given here. If you read your first aid carefully, the delicatessen meats, that is what it has. It has transplacental transmission. It can have vaginal transmission during birth. It grows well at refrigeration temperatures. That means cold temperature acts as an enrichment. Okay. Very, very important. It forms the rocket tails. Okay. It forms these rocket tails via the actin polymerization that allows for the movement, intracellular movement and cell-to-cell movement, and that is how it avoids the antibody. It is a protective mechanism there. Okay. It has a characteristic tumbling motility that is there. It can cause amnionitis, septicemia, spontaneous abortion. Very, very important. This is previously asked. Granulomatosis infantiseptica is your listeria. Meningitis in neonates as well. And in healthy individuals, it is known to cause gastroenteritis. What is the drug of choice? Another previously asked question. Ampicillin is the drug of choice. So remember all these points. It is gram-positive rod, deli meats, unpasteurized dairy products, cold enrichment, rocket tails, actin polymerization, tumbling motility, granulomatosis infantiseptica, meningitis, gastroenteritis, and ampicillin is the drug of choice. Okay, all these are the important ones here. Okay, is this clear with everyone? ब्लड कल्चर में जो ऑर्गेनिज्म ग्रो हो रहा है वो लिस्टेरिया है. इट इज नॉट टॉक्सोप्लाज्मा. टॉक्सोप्लाज्मा का आईजीजी एंटीबॉडी पॉजिटिव है. इट्स अ chronic infection that they are talking about here. The blood cultures are growing this gram positive rod. Okay, so I know that many of you are thinking that कि अगर ये cat वाला है तो ये toxoplasma वाला should have been cat, but here it is not toxoplasma, it is listeria that has been mentioned. The culture is growing listeria. Okay, is this clear with everyone? Okay, so remember, this is what you need to know for listeria. The unpasteurized products and the delicatessen meats is for listeria. Actin polymerization is important. Tumbling motility, right? Ampicillin is the drug of choice. All right, going on to the last question now. This is your last question. So what do you think? What hernia are we talking about? Looking at the options itself, you get to know that this question is something related to hernia, right? So whenever you press that next button on your screens in the exam hall, the first thing that you should be looking at is at the option. तो आपको एक clue आ जाता है कि basically from what area this question is being asked. Okay? So which of the following best describes the relationship of the hernia sac? Already given कि ये hernia है. This is the 3-month-old boy. So in a 3-month-old boy, congenital hernia होगा या young patients में जो hernia होता है, is it indirect hernia or is it direct hernia that you see? What hernia goes through the inguinal canal and into the scrotal sac? Remember, it is the indirect hernia. Indirect is in the inguinal canal and in the scrotal sac. Okay, so that is what is indirect hernia. So indirect hernia comes from the inguinal canal and it goes into the scrotal sac. So it comes from the deep inguinal ring, superficial inguinal ring, right? And then basically it is coming into the scrotal sac. So remember, indirect is in the inguinal canal and the scrotal sac. And if you look at the relationship basically, right, if you will look at the relationship, the Hasselback's triangle, rectus abdominis muscle, inguinal ligament and the inferior epigastric artery. The hernia which comes from here is the direct hernia, okay, and the hernia which comes laterally is the indirect hernia. So indirect hernia comes in an oblique fashion. Direct hernia directly bulges through the abdominal wall. Why? Because there's weak abdominal wall. When does the abdominal wall become weak? When does the abdominal wall become weak? In elderly patients. So very important. This has been asked in the recent exam also. So a direct hernia is more common in elderly. While the inguinal canal wala, the indirect one, young patients can present with that if the sac is wide basically, patent processes, vaginalis, all of that, it is indirect inguinal hernia. So this is the relationship that I have shown here. This one here, this is the inferior epigastric artery. Okay, this is inferior epigastric artery. So remember, direct hernia is medial to that. Lateral indirect hernia is lateral to that. So remember it as MD. Okay, MD, don't lie. Okay, MD, don't lie. Instead of hips don't lie, you remember it as MD, don't lie. So direct is medial. Okay, that's how you will remember. Medial to inferior epigastric is the direct hernia. Lateral is indirect hernia. Okay, lateral is indirect hernia. MD, don't lie. So this is a 3-month-old boy. So this is indirect inguinal hernia. So it is lateral to inferior epigastric. So it is lateral, it is not medial. Option C and D is out. So lateral to inferior epigastric artery and superior or inferior to inguinal ligament. The inguinal hernia is superior to the inguinal ligament. So the correct answer will be B. Okay. What hernia is inferior to the inguinal ligament here? That is the femoral hernia. Okay. Femoral hernia is inferior to inguinal ligament. Okay. So look at this one. Again, a snippet from the first aid. Indirect inguinal hernia. It goes through the deep and the superficial inguinal ring and into the groin. So indirect is in the canal and the scrotum. It is lateral to the inferior epigastric vessels. Lie, lateral to inferior epigastric vessels. Okay. There is failure of processes vaginalis to close. So it can lead to hydrocele also. Okay. So infants, young adulthood is when you will have this. And it is following the pathway of testicular descent. So it is covered by all the 3 layers of spermatic fascia. Okay. So it comes from the deep and superficial and it goes into the scrotal sac. Direct comes from the Hasselback triangle, right? Medial to inferior epigastric, MD, but lateral to rectus abdominis, and it goes through the external inguinal ring, the superficial inguinal ring only, and covered by external fascia. It is more common in elderly males because of the weakness of the transversalis fascia. Okay. So remember, this is direct and indirect, and femoral hernia, FEM. Remember, this is common in females, right? So where do you have the femoral hernia? Below the inguinal ligament. Okay, below the inguinal ligament. So it is below the inguinal ligament, but lateral to the pubic tubercle. Lateral to pubic tubercle, common in females. Okay, and this is very common to undergo incarceration or strangulation. Femoral hernia has very high chances of incarceration or strangulation, is common with femoral hernia. Okay, this is a point that you need to remember. A female patient with a hernia below the inguinal ligament, femoral hernia, risk of incarceration, strangulation is high. Okay, is this clear with everyone? Right, so this completes your basically the fast 5 for today. Like I said, you can keep attempting the quizzes again and again on the Medsynapse app in the quiz section on the home page. You will get the PDF, even the annotated PDF in the featured classes section. Quiz solutions may, there I'll keep uploading the PDFs. When do you have the next classes for the app subscribers? Your next class, basically we had decided tomorrow, that is 11th, we will have Dermatologica KBMD session. Okay, and on 12th you will have OBGY KBMD. This is PYQ of AIIMS exam. Both of this is what we are going to discuss, Dermat OBGY. When do you have the next Fast 5 quiz? That is your YouTube live. So you will have the next Fast 5 quiz on 13th morning itself. Okay, 13th morning we will have the Fast 5 quiz. Okay, so that's your plan for 11th, 12th and 13th. And I hope you've enjoyed the today's Fast 5 as well. The next one will be on 13th. Any changes in the plan anywhere, I keep you posted on my Telegram group. You can see the link of the Telegram group in this channel description as well. You will have the app, Medsynapse app download link in the channel description also again. Okay. So that was for today, guys. Have a great Sunday. And I'll see you again for the app subscribers tomorrow on 11th, at 11:30 itself is when we are going to have the Dermatologica KBMD. Okay. Thank you so much. Goodbye. Take care and keep studying, keep revising and keep winning. Thank you so much.